Do you know, in 1959, deep in the South African, scientists built a top-secret facility to trap death in the air. Their target? Tuberculosis. In a quiet lab just outside the city, a handful of researchers turned a building into a living experiment. Meet the Air Facility, a real-life outbreak lab near Pretoria. They weren't testing medicine, they were testing the air. And what they found back then was chilling. That tuberculosis, nature's deadliest bacterium, could travel through walls, vents and through the air, which we called as airborne transmission. A patient coughing in one room could unknowingly infect someone rooms away. Fast forward to today, April 2025. 65 years later, that same facility is back in the headlines. But this time, it's not about TB. This time, it's something else. Something that's haunted us for 5 years now. That same lab just revealed a horrifying truth about COVID, and why your office vents could be poisoning you. And what it just did may rewrite what we think we know about viruses. This is Health Bulletin, Hidden Histories. And today, we're opening the air ducts of a scientific ghost story, which has one live patient, a golden hamsters and a virus that refused to die. Let's go back again, but this time to 2022. When the pandemic's grip is loosening, and borders are reopening. But in this one facility near Pretoria, South Africa, a team led by Dr. Chad Roy from Tulane University is about to run a bold experiment. The question they want to answer? Can a human infect an animal just by breathing near the same air vent? It may sound like science fiction, but it's not, it's science. 7 newly diagnosed SARS-CoV-2 patients, some infected with Omicron, some with Delta, are brought into the Airborne Infections Research Facility. They live, eat, and sleep there, unaware that 216 golden Syrian hamsters are quietly breathing in the air from their rooms, approximately 7 to 10 meters away. These hamsters aren't in the same room. They're not even on the same side of the building. In fact, they're behind walls, in control chambers, which was connected only by a ventilation system. And yet, 21 days later, 58% of them show antibodies to the virus. Though they weren't sick. Neither weren't coughing. But their blood told the whole story. What we can say, the ghost in the air, here's where it gets creepy. Think back to 2020. You probably remember the confusion. Is it droplets? Or, is it surfaces? Can we catch it from the air? At first, experts were hesitant. They leaned on what we knew from influenza, from past outbreaks. But this virus? It didn't follow those rules. Events like the Washington choir practice, where nearly 90% of singers got sick, hinted at something much scarier. That the virus could hang in the air, invisible. Just like a smoke. More like a ghost. In fact, in this new hamster study, scientists got the proof. A virus that can float from human lungs, travel meters through a vent, and can trigger an immune response in another species. And here's the wild part. These hamsters weren't pre-tested. There was no prior exposure. And the experiment was done at a time when Omicron's transmissibility was sky high. So yes, it happened. And no, this wasn't a lab accident. It was deliberate done. And beautifully designed, says CIDRAP Director Dr. Michael Osterholm. His words? This puts the nail in the coffin. SARS-CoV-2 is an airborne virus. Here's the thing most people don't understand. Airborne doesn't mean inevitable. Dr. Lisa Brousseau, a respiratory protection expert, says what matters is the dose. Think of it like a toxin in the air. A little exposure? Probably fine. But too much? You're infected. It's not deterministic, it's stochastic. The study shows that only some hamsters got infected. But they all had the chance. And that's exactly what public health missed in the early days. That a few particles could hang around, build up in a room with poor ventilation, and tip the scales. Now we know better. But back then, we were fighting a ghost we didn't believe in. Here's what this all means. Air matters. Ventilation isn't just about comfort, it's about containment. The Airborne Infections Research Facility proved it with TB in the 50s, and now, it's doing it again. This isn't about panic, it's about preparation. Because if the next pathogen is as airborne as SARS-CoV-2, and deadlier, we'll need to act faster. We'll need schools with filtered air, hospitals with negative pressure rooms, airlines that don't just recycle breath. And maybe, just maybe, hamsters will save us again. The scariest thing about this study isn't that the virus traveled through vents, it's that it took us so long to believe it could. Science is slow, but the air? The air moves fast. This was Health Bulletin, Hidden Histories. If you'd like to stay updated on global health news and outbreak reports, consider subscribing. Your support helps us continue sharing these important updates regularly. We've got more viral mysteries to uncover. Until next time, breathe safe and stay curious.